All right, good afternoon, everyone, and welcome to our event celebrating the launch of the research report by the Advocacy Centre for Tenants Ontario, entitled The Journey to Housing Stability for Survivors of Gender-Based Violence. This report officially launched yesterday and can now be found on our website. The goal of today's event is to share some key takeaways from the report with all of you. To start, I'd like to introduce myself and my co-presenters for today. My name is Leah Morris, and I am a social worker at ACTO. I am joined today by my Your Way Forward project co-lead, Sumaya Bauer, who is a staff lawyer here, as well as Magda Barrera, who is the senior policy analyst at ACTO. Before we start, I want to recognize that the subjects we are about to discuss may be distressing for some participants, especially those who have lived experience in areas of gender-based violence, housing instability, or housing legal processes. Please do what you need to take care of yourself during this session and take breaks whenever needed. We acknowledge that we live and work on the traditional territories of many Indigenous nations and that our work is part of an ongoing relationship with these peoples. We acknowledge the sacred land that is the traditional territory of many nations, including the Mississaugas of the Credit, the Michisagic, the Anishinaabeg, the Chippewa, the Haudenosaunee, and the Wendat peoples, and which is home to many diverse First Nations, Inuit, and Métis peoples. Our office in Toronto is located on lands covered by Treaty 13 and the Williams Treaties. As settlers working in the social work, law, and research professions, we recognize that our work continues within a colonial legal framework that often upholds systems of oppression. We are mindful of the harmful impacts of our respective professions in implementing policies that led to land dispossession, the denial of human rights, and the breakdown of communities and families. These acts are at the root of the disproportionate rates of violence inflicted on Indigenous women and girls and gender diverse people. We are guided by the 2015 Truth and Reconciliation Commission's calls to action and the calls for justice outlined in the final report on the National Inquiry into Missing and Murdered Indigenous Women and Girls, which call on all sectors to redress this harmful legacy and its impacts on Indigenous families and communities. We acknowledge the urgent need to abandon the colonial policies of the past, address their legacies, and engage in a meaningful process of reconciliation with the Indigenous peoples of Canada. We acknowledge that we walk upon the territories and original nations of the first peoples of this land, whose children, families, adults, and elders continue to call out for justice. We recognize not only the harms of colonization, but also the resilience, resistance, and leadership of Indigenous peoples in the pursuit of housing justice, human rights, and community well-being. We are committed to ongoing learning and relationship building with Indigenous communities and aligning our advocacy with the goals of Indigenous sovereignty and justice. So I'd like to share a brief agenda for today's presentation. We'll start with an introduction to our organization, the project we coordinate, and some key terminology. Then we will talk about the research process and share some of the key findings and policy recommendations from our report. We will talk briefly about the specialized housing legal service that we designed based on the research findings, and we will wrap up by talking about how we hope the report can be useful within your work. We will have time to take a few questions at the end, so please submit any questions you have in the Q&A box throughout the webinar. So if you're not familiar with ACTO, the Advocacy Centre for Tenants Ontario is a specialty housing legal clinic supporting and advancing the rights of low-income tenants in Ontario. ACTO's mandate includes providing legal advice and representation, law reform, community organizing, and education. ACTO is well known for our Tenant Duty Counsel program, where we provide brief legal advice to tenants who show up to their hearing at the Landlord-Tenant Board without a lawyer. For our project specifically, in response to a 30% increase of gender-based violence during the COVID-19 pandemic, the Canadian Department of Justice granted project funding to 9 Ontario legal clinics, including ACTO, to improve access to justice for survivors of gender-based violence. This collaborative initiative is called Your Way Forward, and has been providing wraparound legal services to survivors navigating complex family, criminal, and housing legal proceedings since 2022. So both within the report and also within our service provision, we're very mindful of the kind of language that we use. So I want to talk through some of the terminology we'll use in today's presentation. To start with, gender-based violence. This is a term that refers to the violence that women, girls, and gender diverse individuals face disproportionately because of their gender identity or expression, perceived gender, and or sexuality. It contextualizes the various forms of harm within structural power dynamics. This includes, but is not limited to, intimate partner violence, sexual violence, and human trafficking. Throughout this presentation, we will be referring to gender-based violence as GBV. Next, victim, survivor, and victim survivor are terms used for individuals who have experienced violence. Although the term survivor is often preferred as it is more empowering, the term victim is used in legal contexts. Sometimes survivors also switch to using victim to emphasize the harm done to them. The term victim also accounts for those individuals who have been lost to violence, because the reality is that some won't survive GBV. Increasingly, the term victim/survivor is being used as it acknowledges and accounts for the whole experience. We may use any of these terms during the presentation. And finally, perpetrator, or the person causing harm, are terms used to describe someone who is being abusive and can include partners, ex-partners, family members, caregivers, landlords, roommates, and strangers. Although perpetrator is most often used in legal settings, at ACTO, we prefer to use the term person causing harm.
Great. I'll provide a brief overview of the research process before we move on to talking about the findings. Next slide, please. So first of all, we conducted some background research and we identified that there was a very substantial knowledge gap regarding the housing stability of survivors who rent. We also found that along with the knowledge gap, there was a legal service gap and had an impact and a destabilizing impact on the effects of gender-based survivor on housing. So our research project had two goals. The first was to fill this knowledge gap, increasing the knowledge on the housing stability of survivors. And secondly, linked to the knowledge gap is to inform the design of a specialized legal service that would specifically address the needs that we had identified. So our central research question was, how do survivors of gender-based violence experience the process of securing and maintaining permanent housing in Ontario? And in order to address this, we situated in two different contexts. The first, how well does the legal context meet the needs of survivors? And secondly, how well do housing services meet the needs of survivors? And these are very much interconnected. So we were also examining how these very complicated systems work with each other, and what barriers exist for survivors who are navigating either one or both of these contexts. The research process had three main elements. So the first was a literature review. So first of all, we completed this literature review to examine what existing research had to say about the impact of gender-based violence on housing instability and homelessness. So when we discovered that there was some substantial research, but it had typically focused on a certain phase in a survivor's housing journey. So the time when a survivor is forced to leave their home due to violence. So the research had not usually looked beyond this transition period. So there's a gap in understanding the long-term housing journey of survivors. There also hadn't been much research looking at their housing stability from a housing legal perspective. Secondly, we completed a jurisdictional scan. And here we compared all relevant residential tenancy and social housing legislations that were related to issues of gender-based violence across all provinces and territories. And third, we conducted mixed methods research. So we wanted to identify gaps and barriers that were impacting long-term housing stability. In order to do this, we completed 80 interviews with legal professionals, shelter providers, social housing providers, other key actors. and most importantly, with survivors who had experienced gender-based violence. We later collected 168 responses to surveys, and there were 3 different surveys that were disseminated online. One was for survivors who had experienced rental housing challenges. Secondly, for legal professionals working on rental housing issues. And third, for housing workers who were supporting survivors. And finally, we brought together 58 participants in a policy roundtable. And there we presented our findings, and we discussed potential policy recommendations and collaborated in producing some policy recommendations that fit into the policy recommendations that are presented in the report. So we, as was mentioned earlier, ACTO is a provincial legal clinic. So it's very important during the research process to hear stories from people from all over Ontario. So during the research process, we made an effort to capture the differences between Northern and Southern Ontario and rural and urban Ontario. So the dots on the map illustrate the geographic spread in interviewee and survey participants. Well, we recruited service provider participants using purposive sampling with the target of organizations that provide direct support to survivors who are facing rental housing challenges. And this purposive sampling also helped to ensure geographic spread. And through the service provider participants, then we use snowball sampling to recruit live experienced interviewees. And again, with the goal of having geographic spread. And one component that was extremely important for this research process was trauma-informed research. So the team spent a lot of time interrogating how to limit re-traumatization as much as possible. We knew that many of the research participants would carry significant trauma from their experiences of violence and marginalization. So we wanted them to leave the research process feeling empowered rather than re-traumatized. So researchers incorporated a trauma-informed approach into the research design. And this was informed by the 6 guiding principles that you can see on screen. These were developed by the project evaluator, the Center for Research and Education on Violence Against Women and Children at Western University. And as part of this process, for example, we wanted to create feelings of safety and trustworthiness. So it's building trust from the research participant by sharing information, by taking the time to build rapport. It was also building transparency, offering to share copies of their interview, allowing them to bring a third person to provide peer support if that was helpful to them. It's the element of empowerment, inviting them to the policy roundtable so they could be part of creating policy recommendations. And one final very important element of the research was the duality of roles during the research process. So researchers were often shifting in and out of their roles during the research process, from researchers to social workers, lawyers, policy analysts. So sometimes they had to occupy multiple roles at the same time, and they always had to consider the ethical responsibility to the research participants. As one example, one potential participant that had been referred by a legal clinic was experiencing a mental health crisis when interviewers called them, or the researchers called to complete the interview. So instead of having the interview, the call instead became a crisis de-escalation calls. And researchers shifted out of the research role into the role as providing support, with the social worker stepping in to use counseling skills to de-escalate the mental health crisis. And this use of dual roles within the interviews is very important to build trust with the participants. And it also provided important insights, and it built confidence in the design of a new service, which my colleagues will be discussing later.
In this section of our presentation, we're going to share what emerged from our research as a typical housing journey for survivors in Ontario. This picture on the screen is called a housing continuum. The housing continuum is a tool used by housing policymakers to describe all the different types of housing available to people. When it was first created, the idea was that people could move through it step by step, starting with homelessness and eventually becoming homeowners. Although owning a home is usually seen as the final step, we didn't focus on it in our research because it's no longer a realistic option for most low-income renters. Our research shows that the housing system doesn't actually work like a smooth path. Instead, it's more like a set of gears in a machine, and if one part gets stuck, the whole system can break down. Every part of the housing system is connected and affects the others. Some landlords see their rental properties as separate from the rest of the system, but our research makes it clear that rental housing is a key part of how the whole system works. So firstly, we'll discuss situations of homelessness. Consistent with existing research, survivors must often have to leave their homes because of the violence. In fact, only one of our lived experience participants was able to remain in her unit. After leaving, survivors most often couch surf with friends and family, which put notable strain on their relationships. In Northern, rural, and Indigenous communities, couch surfing had become so prevalent that it was sometimes discussed by interviewees as a permanent housing option. We also heard that others have taken shelter in hotels, cars, garages, and unwinterized sheds and cabins. This is known as hidden homelessness. Although there's a lack of concrete data on the prevalence of visible homelessness, current counts show that there is an increase in encampments all across the province. A recent Freedom of Information request highlighted that Ontario's official homelessness count is at 234,000 people, which is almost 250,000 people. In our research, 27% of the lived experience participants resorted to living outside at some point in their housing journey. If a survivor became unsheltered, the trauma of the experience made it much harder for them to restabilize even after intervention. In our group of lived experience participants, if the person was unsheltered at any point in their housing journey, then they experienced many more years of homelessness and housing instability. Now we'll talk about emergency shelter. 73% of the lived experience participants we interviewed had to enter the shelter system, and most of them told us that they were there reluctantly. We heard that shelters are almost always full, which means many people in crisis are being turned away. The most recent numbers say that 82% of people who call for shelter don't get in, but we believe the real number is actually much higher. For those who do manage to get a bed, we were told that shelter staff are overworked and overwhelmed, which led to inconsistent support. Sometimes it led to major mistakes like a missed deadline, which meant that the survivor missed out on a chance to get housing. We heard many stories of bullying, discrimination, and even suicide in shelters. And sometimes the only available shelter beds were completely inaccessible for survivors with disabilities, which impacted their dignity. For those in the shelter, finding affordable housing within the short allotted length of stay was challenging, if not impossible. This meant that survivors were sometimes pushed out of the shelter to wherever would take them, which was often a precarious or dangerous living situation. The stress of having nowhere to go at the end of the stay was described by one of our lived experience participants as walking the plank. Although gender-based violence shelters were granted pandemic funding to help with the increased demand, this funding was cut in 2023, even though calls to shelter services have only increased post-pandemic. Survivors may be able to access transitional housing for around 1 to 2 years. So, unlike living in emergency shelters, survivors do not have the extreme stress of finding new housing within only a few weeks. 32% of our lived experience participants spent time living in transitional housing and said that being there felt like they had won the lottery. They had more time to work through their trauma with trained workers, and they were able to regain a sense of independence. Although survivors have better outcomes and are more likely to achieve long-term housing stability after staying in transitional housing, Ontario does not provide transitional housing programs with any core funding. This means that there is a severe lack of transitional housing, especially in northern and rural communities. We should mention that due to the housing crisis, some survivors still cannot find an affordable rental unit even after this longer time frame. Supportive housing is permanent housing, and it has integrated supportive services for people with complex needs, substance dependencies, and/or disabilities. Services are varied for each resident depending on their need. Similar to transitional housing, supportive housing has been shown to improve long-term housing stability. However, demand for space is high and there are long wait lists. Service providers shared that they are floored by the increasing number of survivors with complex mental health needs and substance dependencies accessing their services. And they were honest that they're struggling to support them. Clients with complex needs then end up repeatedly accessing already overwhelmed shelters and hospitals who don't have the resources to support them in the long term. Alternatively, those with complex needs end up living in social housing or in units in the private market where landlords are not equipped to provide the kind of support needed to promote housing stability. You know, we often hear that the system acts like a revolving door, and in the case of the most vulnerable survivors, we'd reframe this as a locked door. Notably, there is no specialized supportive housing in Ontario for survivors of gender-based violence. After leaving the home, many low-income survivors will move into publicly funded social housing via the Special Priority Program, or SPP for short. SPP is a program that fast-tracks survivors experiencing trafficking or intimate partner violence to the front of the social housing line. Social housing is often the only affordable housing option for low-income survivors, especially those with large families surviving on Ontario Works or ODSP. 50% of our lived experience participants accessed social housing through this program. However, after years of underfunding, social housing units are scarce, with around 177,000 people on waitlists as of 2022. Based off correspondence we've had with the City of Toronto's Housing Secretariat, this number has only increased. To manage these long waitlists, the Ontario government recently moved to what's called a choice-based system. But we heard that this name is misleading because although the housing access system allows people to select units that they're interested in, they must accept the first offer that they're given, which is down from 3 offers in 2021. This is one example of a policy initiative that was designed to help with operations management, but has since had unintended consequences for the service users, like survivors. For example, one lived experience participant told us she was offered a dilapidated unit. It was clearly previously a squatter's residence, and it was frankly unlivable. Her service manager pressured her to either accept the unit as is, or she'd be taken off the wait list. Well, she declined the unit and she was taken off the wait list and she was forced to leave her community. The next step on the housing continuum is affordable market housing. But according to the Canada Mortgage and Housing Corporation, whose data is what is used by our provincial policy decision makers, there is no affordable housing left in Ontario. To help tenants afford costly private market rents, the federal and provincial governments introduced a portable housing benefit. The Canada-Ontario Housing Benefit, or COB, is only offered to selected people from priority groups on the social housing waitlist. Those with the SPP status would be one such group. If an applicant accepts the COB subsidy, then they're removed from the social housing waitlist. Because private market rent has gotten so high, in 2023, only 1.2% of selected eligible households were granted COB, as the available funds quickly run out. At this point, COB is set to expire in 2029, and survivors have told us they're afraid of what's to come if it stops. Often, survivors' only remaining option is to go to an unaffordable private market where they face discrimination and exploitation. We heard of survivors that provided sex for rent, free labor, or landlords asking for a year's worth of rent up front. And we heard that newcomers, migrant workers, and non-status survivors face these forms of discrimination and exploitation most severely. We've heard of landlords offering unlivable units to survivors, such as units with no kitchens. And only 18% of our lived experience participants have rented units in the private market. Broadly from ACTO's research, in this landlord's market, at least 40% of tenants are struggling to pay rent. This is a quote from a survivor who moved into a private market rental unit, who explained that for her, every day is a struggle to survive. She said, "Now in my retirement, I'm really, really tired. I'm really tired. I'm drowning now. And each month it's like a struggle just to come up with that, other $1,000 for the rent and to live. Meagerly too. This isn't living. It's certainly not thriving. It's hardly even living." We'll now look more closely at the legal context, starting with the unique rental housing issues that survivors face and the legislation that exists currently. When we asked participants to talk about the common rental issues faced by survivors experiencing gender-based violence, participants found the following issues occurred when a survivor was still living with the person causing harm, and or even after the survivor successfully left the person causing harm and began living by themselves. Starting with the first one, rental arrears. Rental arrears was identified as the most common issue leading to survivors being evicted from their units. This can happen because financial abuse is occurring. Financial abuse includes the person causing harm stealing money, keeping the survivor's money, or telling them if and how they could spend money. Second came damages that were a result of gender-based violence, where the person causing harm may have broken a door or punched holes in the wall. And when the survivor can't pay the landlord back for the cost to repair it, they usually receive an eviction order. As mentioned, survivors are often forced to rent units in disrepair and reported having issues like mold, exposed wiring, and pests that the landlord refused to fix. Also, survivors often lived in units that were not covered by rental protections. For example, they may not be a tenant on the lease, or they may share a kitchen or bathroom with their landlord, which meant that they could be locked out of their unit without much recourse. Landlords can also threaten eviction because of disturbances caused by gender-based violence. So a neighbor might complain about noise or fighting that they overhear. They'll complain to the landlord. And rather than the landlord trying to accommodate or understand the survivor, they serve them with an eviction notice for causing a disturbance. An emerging trend is the prevalence of sexual violence from landlords, where landlords are requesting sex in exchange for rent. Additionally, roommate abuse was also raised because more and more people are living together in smaller living spaces. And then lastly, survivors experience discrimination from prospective landlords due to gender-based violence, race, family status, income, and sexuality. This often occurred in rural and small towns where landlords may know the person causing harm or know that the survivor came from a gender-based violence shelter. When survivors face this constant carousel of rental issues, they often choose to leave the unit rather than staying to fight the rental issues. And they may also be unaware of their tenant rights or that housing legal services even exist. Even when survivors are aware that they have legal recourse, it may not be a safe situation for them to stay and fight. For example, one survivor said, "I should have sought some sort of legal help there, but I also didn't want to stay there. Yeah, I wanted to get out of there and get away from them as soon as I could, but I knew I was being illegally evicted, but it wasn't a safe place for me to be." When survivors want to fight their housing legal challenges, they have limited options. The Residential Tenancies Act, or RTA, governs the rights and responsibilities of landlords and tenants in Ontario. Unfortunately, there are few protections for survivors under the RTA, as it doesn't consider ways in which gender-based violence creates rental issues. It only allows survivors to leave rather than remain in their unit when experiencing violence. For example, it's often very hard for survivors to remove the person causing harm from the rental lease, especially when they're joint tenants. Joint tenancy means all tenants sign the same lease and they have equal rights to the home. So one person can't be taken off the lease without the other person's agreement. This is even the case if the person causing harm hasn't lived there for years or isn't legally allowed to return. Also, the survivor might be equally responsible for rental arrears or damages caused by the person causing harm, but they might be on the hook for everything if they're the only one who wants to keep living in the unit. Some survivors may ask the landlord to change their locks for their safety, but if the person causing harm returns and asks the landlord for a key, then the landlord's legally obligated to give all the tenants on the lease a key. If the survivor is the only one who wants to keep living in the unit, it can be difficult to change the lease or create a new one with just the survivor's name on it. First, they would need consent from the person causing harm. Second, the landlord could refuse to remove one joint tenant from the lease. Often, we hear that the landlord wants to create a new lease, and they want to charge whatever the going rate is for market rent, which can be hundreds of dollars more. If the survivor has a good relationship with the landlord, they may try to advocate for a new lease with either a low rent increase or keeping it at the same amount. If survivors who are tenants do want to leave the unit, they can end their tenancy early by giving the landlord an N15 notice to end tenancy because of fear of sexual or domestic violence and abuse. The N15 form is shown on the screen, and it frees survivors from being liable for the rent once they leave. Without the N15, a survivor would be responsible for paying the monthly rent until the end of their lease. Our research has shown that this has limited usefulness in light of the affordability crisis because landlords profit from tenants leaving. They can increase the rent for the next tenant. Out of the lived experience participants we interviewed, only one had ever used the N15. When a survivor gives the landlord an N15, they can't use or get back what they paid for the last month's rent deposit. And also 28 days isn't a very long time to find new housing or to save money for a rental deposit. So these lack of protections highlight that when the Residential Tenancies Act was amended to input protections for gender-based violence, the decision makers didn't understand the reality of the housing continuum and that there is nowhere for survivors to go once they end the tenancy.
So the final step in our research process was the creation of 17 multi-system, multi-pronged policy recommendations. These recommendations were created in consultation with key service provider stakeholders and lived experience experts during the research process and at the policy roundtable event that we hosted. The recommendations aim to tackle the housing crisis faced by survivors through improving their long-term housing stability and breaking down significant barriers to housing stability in the justice system. For the sake of time, today I will highlight just a few of the recommendations in the final report. The first recommendation in the report is to declare intimate partner and gender-based violence an epidemic. So both the rate and severity of intimate partner violence and gender-based violence continue to rise across Canada, with overall rates of police-reported family violence increasing by 17% and intimate partner violence by 12% between 2018 and 2023. In response to this growing crisis, and as recommended by the Renfrew County Inquest into the 2015 murders of Carol Culleton, Anastasia Kuzik, and Natalie Warmadam, and the Mass Casualty Commission into the April 2020 Nova Scotia mass casualty. All levels of government must formally declare intimate partner violence an epidemic. This public declaration acknowledging the prevalence of GBV would compel all levels of government to increase funding to end GBV, which would include adequate funding for the housing and homelessness sector. Because survivors face unique rental housing challenges because of the GBV, the provincial government must also increase funding for housing legal services to support survivors' right to security of tenure. In addition, a declaration of intimate partner violence as an epidemic could be used immediately in courts, tribunals, and administrative bodies as evidence that adjudicators must consider the severity of a survivor situation when making their decisions. This has the potential to enhance survivors' access to justice. To date, Nova Scotia, British Columbia, and 100 Ontario municipalities have declared IPV an epidemic. Next, I'll discuss policy recommendations 4 and 5. So recommendation 4 is to increase the supply of transitional housing, including in rural and northern locations. Transitional housing serves critical needs for survivors, and they are chronically underfunded and with lack of sufficient spaces to meet demand. Transitional housing was highlighted in our research as being particularly important for survivors as a pathway out of shelters and toward independent housing. Transitional housing allows for a longer length of stay, helping survivors to access supportive services, develop a sense of community, and heal from their trauma. Despite this importance, transitional housing receives very limited government funding and must often rely on fundraising to operate. The shortage of transitional housing is particularly acute in rural and northern locations. So increasing the number of transitional housing options and providing core, stable, and predictable funding will be critical in enabling survivors to move toward permanent housing. For recommendation 5, to increase the supply of specialized supportive housing for survivors, the lack of supportive housing has led to survivors with disabilities and complex needs struggling to remain housed. Increasing the provision of supportive housing would ensure that survivors with complex needs are protected from a heightened risk of experiencing further violence, discrimination, and homelessness. This expansion of accessible services would improve housing stability and prevent further harm. Within both the expansion of funding for transitional housing and supportive housing is the need for targeted multi-year funding to Indigenous communities and organizations to develop and sustain culturally appropriate housing and supports. This is identified in more detail in our third policy recommendation, which calls for increased Indigenous-led supportive services and Indigenous housing to provide a response that understands the needs of Indigenous survivors and the depths of systemic trauma Indigenous communities have experienced as a result of colonial violence. The last two policy recommendations I'll discuss are number 13 and 15. So recommendation 13 is to improve access to justice for renters experiencing GBV. Survivors frequently have negative experiences at the landlord-tenant board, as they feel unprepared and overwhelmed by the process, and often have multiple legal issues to deal with in addition to housing, including family, immigration, and social benefits matters. To improve access to justice for renters experiencing GBV, the provincial government should increase access to legal supports by increasing the financial eligibility criteria for legal clinics and expanding Legal Aid Ontario's domestic violence certificate program. The government should also increase access to justice at the LTB by appointing specialized adjudicators to be assigned to hearings when GBV is raised and establish a clear mechanism at the LTB for survivors of GBV to request procedural accommodations, such as in-person or closed hearings, to support their safety and their participation in the legal process. The government should also introduce wraparound social work services for renters who must attend a hearing at the LTB, in particular survivors. This would provide direct support when navigating the LTB process and provide emotional support for the duration of a stressful, often re-traumatizing experience. And finally, recommendation 15 is to provide trauma-informed legal and housing services. Numerous survivors reported experiencing a lack of understanding from legal professionals and housing system workers. In turn, these professionals reported not receiving the type of training that would allow them to communicate effectively with survivors. Addressing these gaps in training would help workers better communicate with survivors and avoid inadvertently re-traumatizing their clients. With this in mind, we recommend that government-funded services provide trauma-informed housing services and supports that include training on the unique housing issues that survivors face. We also recommend that they offer professionals who support survivors access to counseling to reduce vicarious trauma and compassion fatigue. Finally, we recommend that they prioritize anti-oppressive and culturally safe spaces, including the expansion of specialized services for marginalized communities. One approach to improving both access to justice and to work within a trauma-informed framework is offering specialized wraparound services for survivors, which is discussed in more depth in Policy Recommendation 16. Next, we'll discuss our approach to specialized wraparound services at ACTO.
We'll talk now about the specialized housing legal service that we developed. The insight that we gained from the research led to the development and launch of Canada's first specialized legal service for tenants experiencing gender-based violence. Survivors have guided us throughout this whole research and design process, and this lived experience participant sums up the importance of person-centered services that prioritizes survivors' self-determination. She said, "The last thing you want is there to be additional hoops you have to jump through. It's silly. Can you just try to set it up in a way where we have as much agency and choice as possible? And then we can decide what we want to do." And so our service is comprised of 8 parts. First, we provide legal representation and advice for tenants experiencing gender-based violence. This involves helping them with housing access, representing them in tenant applications for repairs and maintenance issues, and fighting evictions. Second, we provide wraparound support where every client receives services from a lawyer and social worker through Leah and I. We each have a unique yet complementary skill set, and our partnership strengthens the quality and impact of the services that we provide. Services are trauma-informed and integrated into our practice, where we do all of our intakes together so that clients don't have to tell their story more than once, and they have counseling support while explaining their whole rental journey. We are low barrier in that we have waived income eligibility rules, and we do not have time limits to our services. We help no matter the immigration status, and we have free interpretation services if needed. We're collaborative in that we've taken time to get to know key actors in the gender-based violence and legal sectors, and we are part of a multidisciplinary team encompassing family, criminal, and housing law through the Your Way Forward initiative. Our work is informed and evaluated by key informants and survivor feedback. Our system model can be replicated across Ontario's community legal clinic system, and we engage in law reform to improve survivors' chances at achieving long-term housing stability. Some ways that this report can be used are in legal advocacy, such as for evidence and submissions at the Landlord-Tenant Board to demonstrate the serious and systemic impact of gender-based violence on survivors' housing. Our findings show that Ontario's housing crisis is deeply linked to gender-based violence, and survivors are often forced to choose between staying in unsafe homes or entering homelessness because the systems meant to protect them are failing. With a severe shortage of affordable housing, many survivors face impossible choices. This report can support advocacy efforts aimed at government decision makers to prioritize survivor accessing safe housing. This includes emergency shelters, transitional housing, and long-term affordable options. Our findings point to the need for more research, especially on the experiences of marginalized survivors from specific communities. Understanding their unique needs and barriers will help create better targeted recommendations. And there's also a need for more quantitative research to further strengthen and validate these findings. Our report can be cited in academic research and policy studies related to gender-based violence, housing justice, and intersectional systems of oppression. It also serves as a valuable research to educate service providers, students, and the public on the realities survivors face and the types of support they truly need. Other legal clinics and community organizations can adapt our model of specialized housing services to better meet the complex needs of survivors in their own regions. And that brings us to the end of our presentation. Thank you all so much for your time and attention today. We want to acknowledge that many of you have supported this research project over the years. You may be a colleague, a stakeholder, a student, an attendee from the policy roundtable, or a research participant. To all of you who have been involved, thank you. In particular, thank you to the survivors who trusted the research team with your stories. Thank you to the Department of Justice for your financial support in making this project possible. And finally, we want to give a big thank you to the authors of this report, Karen Harvey, Michelle Cha, Magda Barrera, and myself. We now have time for our question and answer period.